The National Syndemic Diseases Control Council now says that children account for 22% of new HIV and AIDS infections and 13% of HIV-related deaths, with adolescents and young people aged 10 to 24 making up a third of all new cases. The council's acting CEO, Douglas Bosire, equally raised an alarm over the surging numbers in the arid and semi-arid ISAL counties, further insisting on the need to ensure universal health coverage is accessible for all. And as Jacob Oshiro reports, funding remains a major challenge in efforts to end HIV and AIDS by the year 2030.
As Kenya gears up in joining the rest of the world to mark World AIDS Day on 1st of December, the National Syndemic Disease Control Council has raised an alarm over the new statistics of newly infected persons. Addressing the press, the council's acting CEO, Douglas Bosire, cited a worrying trend of the infections, especially among the young population.
1% of the new HIV infections among adults in the year 2024 was among 15 to 24. However, if you broaden that bracket again to 34 years, 75% of the new adult HIV infections occurred amongst those aged between 15 and 34 years, 75%. So we have a reason to be concerned. And we know that this group of adolescents and young people having too much unprotected sex.
Arid and semi-arid counties have also been cited as the most affected, with the council now insisting on the need to increase a balance in the efforts to reduce the numbers of infections.
Average in the country, 9 out of 100 mothers who were pregnant and HIV positive passed the virus to their children in the year 2024. When you go to Wajir, 33 of the 100 passed the virus to their children, as opposed to 9 nationally. In fact, you have 7 counties up there, up north, who had mother-to-child transmission rates of above 20%, which is almost double or triple the national average.
Despite funding proving to be a major hindrance in the fight against HIV and AIDS, especially after the withdrawal by USAID, NASCOP's Dr. Andrew Mulwa has pledged to ensure HIV patients are equally covered by the Social Health Authority to ease the burden of access to treatment.
Part of the new financing agreement that we are going to have with our partners will be geared at ensuring that HIV services, TB services are covered in the social health insurance mechanism. With those remarks,
stakeholders have equally been urged to join hands in the quest to reduce the worrying numbers of HIV and AIDS infections that now stands at 1.3 million.
Let us claim the HIV narrative, elevate the national conversation, and together achieve the goal that we need to end HIV, particularly among adolescents and young people, and to the future we desire of an AIDS-free generation. While launching HIV Media Awards, the National Syndemic Diseases Control Council has equally announced World AIDS Marathon scheduled for 30th of November at the National Stadium as part of the sensitization campaign. For Newswatch, my name is Jacob Ochiro.